going to talk about preterm labor and then the stages of labor. Some of the signs of preterm labor include low backache that's not normal for your pregnancy and a low cramping, kind of like menstrual cramps, okay? Or you may be having like a sensation of diarrhea cramps. So this will be a tightening of your abdomen in a regular like pattern that's happening more than 6 times an hour. If you're before 37 weeks and this is happening 6 or more times an hour, it's definitely worth calling your provider. I highly encourage you to drink a big old jug of water while you call them, because one of the number one reasons that people go into preterm labor is because of dehydration, okay? Other symptoms that you could be having would be low pelvic pressure. Those things are concerning. So dehydration and urinary tract infections are the 2 biggest causes of preterm labor. And other infections can also cause your body to go into preterm labor as well. Let's talk about the stages of labor now, okay? So now you're more than 37 weeks, so your term. Stage 1 of labor is actually broken up into 3 different phases, okay? The first phase is early labor, and it's from 0 centimeters to 5 centimeters. This period of time can be so confusing for some people because you don't know if you're in labor and you keep questioning yourself because you feel totally normal in between contractions. You might be having irregular contractions, or they might start and then go away. And some people even have what's called prodromal labor, meaning they continue to stay and come and come and come, but it's not dilating your cervix. So how do you know if early labor has really started? This is the question, right? Some experience the contractions are more regular, usually anywhere between 7 to 20 minutes or so. And they're usually lasting about 30 to 45 seconds apiece. Maybe on occasion you might have a minute-long contraction or an odd one that lasts longer, but you'll experience it by tightening of your abdomen. You might feel low cramping, and you might have low back pain that's coming and going. There's really no need to time your contractions at this point in the game, okay? You can time them if you want for 5 or 6 contractions just to get an idea of how close they are, but we're not in the active stage of labor, so it's really not necessary to focus there. The duration of this phase can usually last about 12 hours or sometimes days for first-time moms. It'll likely be shorter for people who've already given birth before. Now, tolerance. How do you tolerate these? You can generally continue to walk and talk through these contractions. Distraction works really well, movies, card games, going for a walk, so many different things. Some people still choose to stay at work, They might be inconsistent in their intensity too, where one is rated like a 4 on the 1 to 10 pain scale, and others might feel like an 8. So it's not consistent in their timing or their intensity, okay? And the discomfort that you feel with these contractions is going to vary from one person to the next and from one birth to the next. A lot of it depends on the position of the baby. So some of the common experiences in this phase of labor is low back pain. And if you're experiencing low back pain, it is highly likely due to the baby's position. Like part of the baby's head is hitting a nerve in your back. And so that's either causing low back pain, or some people even experience pain down their thighs in the front. So if you're experiencing that pain or prodromal labor and it's going on, I highly encourage doing the exaggerated sideline position. I'll put a picture in here so that you can see what it's like. It's best if you don't use a pillow underneath your head or your upper body, but that the head, upper body, and the belly is flat on the bed. Your belly is obviously tipped some because the baby's in there, but it will feel like you're laying on the baby. Your bottom leg is going to be extended straight, and that upper leg is going to be placed either on several pillows or maybe even a peanut ball. And you want to bend that top leg up as high as you can toward your chest. This is going to help your pelvis be asymmetrical, and it'll help encourage the baby to rotate. Now, this is one of my favorite positions, and it doesn't matter if you have an epidural or not. There are so many people who I want to sleep in this position, and they do toward the end of their pregnancy. Now, you could also do curb walking or sidestepping on the stairs, meaning going up 1 or 2 steps while facing the side. So instead of climbing up the stairs like you normally would, you go sideways, okay? And this does the same thing. It makes your pelvis be asymmetrical, and it helps to open things up so that the baby can rotate. Another common experience at this point is losing your mucus plug. Now, you may have already lost your mucus plug, or you may have been losing it because it does generate. So losing your mucus plug on its own doesn't really signify anything, but If you have lost it here, that's fine. Okay. During this phase, emotionally, you're probably going to feel fearful because you don't know how things are going to play out. Like you feel a little bit hesitant because you're afraid to get your hopes up that this is really labor. And it's not uncommon to face this part of labor to feel like emotional, like you're watching TV and you start to cry at strange things that you might not normally cry over. Perfectly normal at this point. Remember, we've got a lot of cascade of hormones going on during this phase. Okay. What's the best activity and how do you cope during this time? I highly encourage you to continue with your normal routine. If you're at work and you want to stay at work, stay at work. It's okay. If you're at work and you want to go home, just tell them you're ready to go home and head home. But walking, eating, sleeping, drinking, those are all great things. If you don't think you can sleep, get up and go for a walk with your partner. Things like showers, baths, games, movies. We talked about some of this a little bit already. These are great distractions at this point. And as far as your partner or support person, your role at this point is going to be help them to be distracted. Okay. She might forget the plan of all the distractions she was thinking of because she's excited. So have a list of things that you might do together. It'll be a great thing to reference back to throughout the labor process. Okay. And in each segment, I'm going to put different things that the support person can do. And so for here, the most important thing for you to do is help to distract her. Now, on occasion, you are going to be surprised because she doesn't want to be distracted. She just wants to be left alone. That's okay too. Listen to what she needs. Okay. So how do you prepare now for this part of labor? I encourage you to be practicing mindfulness and breathing and visualization exercises because these tools are going to be extremely useful during birth. And if you practice them in pregnancy, couples will often do it together. That's going to mean that it'll be a much better tool for you during the labor process. And you can also go ahead and get that list made, the list of things you might want to do for distraction in the early phase of labor. Okay. So walking, movies, TV, I don't know, pick a show you want to binge watch. All right. Once you get to the active phase of labor, you're going to notice a huge shift. Okay. This is between 6 centimeters and 8 centimeters, and the contractions are going to be more regular. They're going to be more consistent in their frequency and their intensity. So they're going to be coming about every 2 to 5 minutes or so, and they'll last about a minute long. Okay. And they're going to feel more consistently the same. So instead, when you were at like a 4 and an 8 and a 4 and a 2, now they're going to be like 4, 5, 4, 5, 5, 6, So generally, you're going to have to stop walking. You're going to have to stop talking through these contractions. And this phase can last for about 4 to 8 hours for first-time moms. It's usually much shorter for those who've already given birth before. However, position of the baby. So how do you know when you have to go to the hospital or call your midwife if you're doing a home birth? Let's start by learning how to count your contractions. So contractions are counted from the beginning of one contraction to the beginning of the next contraction. So if you had a contraction at 5 o'clock, and then the next one started at 5:04, you have contractions that are about 4 minutes apart. And so you time about 5 or 6 of these. You can use an app or you could just use the clock. And the goal we usually say to know when to go to the hospital is 4-1-1. That means your contractions are about 4 minutes apart. They're lasting a minute long. And this has been going on for an hour, and you cannot walk and talk through these. Okay. This is if it's your first child. If you've had other children, you might have to go a lot sooner, but it's really important to speak with your midwife or OB during your prenatal appointments to find out what their preference is, because everybody's a little different in when they tell you to come to the hospital. Okay. And then if you are not sure, if you have to ask yourself, am I in labor? The answer is highly likely no. And if you have to say, should I go to the hospital? The answer is most likely no as well. But I want you to think, I have to be in the car for that many minutes. So am I at a point where I feel like I can actually be in that car for 4 contractions if you're 20 minutes away, or 5 contractions if you're 20 minutes away? Because knowing if you think you'll be able to cope sitting in the car, that's going to be a huge indicator of whether or not it's time for you to head on out to the hospital. Okay. So again, make sure you check with your provider and do what they recommend for your situation. They have a lot more information about you than I do. So go with what they're telling you, okay? And then also trust your intuition. If your intuition is telling you it's time to go, just go. Now, during this time, you're highly likely to feel very excited. You're either at the hospital or headed to the hospital. Your midwife's here. You're just, you're kind of charged and excited. You're feeling like, yeah, I can do this. Like each contraction you feel is a bit challenging, but in between, you're feeling great. So you're doing well. Now, what kind of activity and coping is good for the active phase of labor? Your support person's likely helping you cope with the pain now differently. Rather than distraction, they're probably doing massage or counter pressure. They may be doing things like coached breathing. So when you're breathing in and out, they're telling you, okay, melt into the bed. Make sure you relax your forehead. Make sure you relax your jaw with each breath, right? So there's so many different things. Refer back to the comfort measures class and use those tools, okay? Because having coached breathing works for some. Now, support people, if you're helping and they get irritated with you, just don't take it personal. Just ask them how you can support, but don't ask them questions during a contraction. Wait till they're in between, have taken a nice deep cleansing breath and come back to you, okay? So here also walking continues to be really a great tool because the movement, like in the Lamaze philosophy of birth, the movement is so great. And studies show that the movement sitting on the ball, sitting on the toilet is super helpful. We call that the dilatation station because it's so helpful. You can use the shower in the hospital room, and some have baths that you can use. We call that the midwife's epidural because the heat from the water and the pressure from the water help to distract your brain from processing the pain signals, right? So it's so incredible to be able to labor in the water. Now, some are going to just want to be laying in the bed, and that's okay too. That exaggerated side lying position is great in this situation. If you have an epidural at this point, remember position changes are still really important. You can hike your leg up over the ball, and you can, if you're awake, you can actually rock and roll with those contractions and then lay still in between contractions. You can put the bed in a throne position. You can get on hands and knees. Really, there are no limits unless you have an extremely dense epidural. If you have an extremely dense epidural, then it can get a little tricky, okay? But you're likely going to need your support person and your nurse to help you change positions anyway. So you just keep asking. And remember, we want you to be changing positions about every 5 contractions. Some common experiences at this point include things like vomiting. So vomiting at this point is really helpful. Actually, it actually can help you dilate further. We see the vomiting common at 5 centimeters and during transition. It's always kind of fascinating because moms they'll be like, oh my gosh, I'm going to puke. You grab them the bag, they puke, and they're like, I don't even feel sick. Why did I throw up? And it's just the body's way of helping to push the baby's head down further against that cervix to help you dilate and to get things to progress. Another common experience at this point are the labor quakes or the labor shakes. You're shivering uncontrollably. Many people will ask for a warm blanket, and we love to give warm blankets in labor and delivery. But one of the best things to do if you have these uncontrollable shakes is to stick your tongue out. Now, I know that sounds very bizarre, but sticking your tongue out like this or like this can actually help decrease those shakes. Now, the shakes are likely caused by the hormones that are flooding your body. Your body's ready to let go of the baby, and it's very tricky because we want to hold on to it. It's like a battle. And I believe sticking your tongue out has something to do with the vagus nerve, so it just helps it mellow out some. And if you're not able to calm those shakes by sticking out your tongue, I really encourage you not to fight the shakes, because if you fight these shakes, you're going to be very sore tomorrow or the next day after delivery, right? Because you're fighting so hard to not shake. Sometimes those shakes feel so violent. They're not because of the epidural or Pitocin. It can happen at any point. Now, how do you prepare for active labor? Practice the positions in the link below, okay, throughout your whole pregnancy. The positions for laboring and the positions for pushing, all right? Now, these are copyright protected, so please don't print them out and spread them to everybody. You get them because you're a part of my class, okay? Practicing these positions now will make sure that these tools will actually be helpful in the labor process. If you don't practice them, they're not going to be useful, okay?